Carly, where are you?
All right.
So,
Yeah.
my name is Julie. I'm a grad student.
I'm Rebecca. I'm one of the clinical fellows here.
I'm Carly. I'm the other clinical fellow here for speech. We thought it would be fun to do a little video about our fellowship and kind of just like talk about how it's been going and things we didn't expect and things that like exceeded expectations. And then as we kind of go, Julie has some questions for us since she'll be starting hers soon. So we figured we'd kind of do a fun little video about it. You want to start us off with something?
So what made you want to get a degree in communications disorders? Is that what your school calls it too?
Mm-hmm.
Or is it different?
Disorders.
Yeah, my undergrad was in communication sciences and disorders.
Mm-hmm.
So I, my whole life, wanted to be a nursing major, and then the more I got into the classes, I just didn't want people to tell me what to do all the time. And so I called my mom on my spring break. I said, Mom, I'm dropping this major. I need you to pick one out for me.
Mm-hmm.
And she called me 3 days later, and she said, remember when you were little and you went to speech therapy because you had apraxia? I think you should look into speech pathology. And I did. And then I applied to the major the next day and started 3 months later.
For me, I always knew that I wanted to help people. So like I'm just a huge people person, and I am deathly afraid of needles. So I knew like I was not gonna be a doctor or a nurse or anything like that. And my grandparents and a couple of my aunts like have used speech therapists like just throughout, and so it kind of just happened honestly, and I'm so happy that it did.
Awesome.
It's the best job ever.
Where did you guys want to go to grad school at? Where were you guys from?
So I'm from Apex, outside of Raleigh. I did undergrad at UNC Greensboro and grad school at East Carolina.
I am from Louisiana, so I did my undergrad and grad school in Lafayette at the University of Louisiana Lafayette.
That's awesome.
Yeah.
Let me see. What kind of placements have you guys had?
So
while being in grad school.
my grad school, we had an on-campus clinic that we were in for 3 semesters. So we saw everything, kids and adults. I knew I wanted to do kids, and I liked the medical side of it. I had one placement for adults at a hospital, an outpatient, and did a little bit of inpatient too. And then I had another placement at another big hospital doing pediatrics.
We had an on-campus clinic too, so we always had clients at our on-campus, and then when we did placements, I was at a hospital. I did outpatient, inpatient, and acute, and then a school, elementary school. And then I did a private practice in the summer for like 3 weeks, like a cerebral palsy private practice.
Is there a preference that you've had after going to each placement, or?
Well, I only knew hospital and clinic. I really liked the hospitals that I was at. They were both super great. There were some limitations to hospitals. You're in such a controlled setting that knowing I wanted to do feeding, it's really hard. You have a lot of contact with all the professionals. Everyone is really available. But it's carryover can be difficult when you're going somewhere and in such a controlled setting. Making sure that everything at home is going well too is kind of difficult. But I love the hospitals.
I literally love everything, which was like, it's a great thing about our field. I think I was telling you about this the other day. I was like, it's such a great thing about our field, but then for the people like me who like everything, it makes it a lot harder, I feel, of like figuring out what in the world I'm going to do. But I really liked the hospital too, and that was one of the hardest things was with inpatient and acute. Like, you see them for maybe like a week and then they're gone and you may never see them again, and you're like, well, like I didn't like not being able to like follow up with them and like see the progress. Like you see them and then it's like, okay, well, hope you do well. I'll see you later. So I really liked that. I liked everything though. I liked elementary school because I love kids. But I am more of I like seeing kids one-on-one versus a group, because I feel like in a group I would be not as good as like meeting the needs of the kids. So I like the one-on-one and being able to like, I know what I'm doing is for this specific kid. And then you don't have to like generalize it. That's why I really like private practice.
How was the transfer over from being a grad student to now applying for your CFYs? Is that
crazy?
Is it?
Like I literally, because in you obviously, you learn and you get some experience, but like you don't know, you really still, I felt like I still was like am I ready for this? Like,
Yeah.
I have no idea. And then you just kind of have to take the leap, and, you know, it's something that we love. So we're obviously going to do our best. And, like, but yeah, it's definitely hard, like, jumping into that and just, okay, now I'm, like, a professional and have to start working and kind of figure it out as you go. I don't know. It was scary.
I remember the first time I tried to decrease a kid's services. And I, like, went to one of my supervisors and I was like, is it okay if we decrease? And they're like, you're the clinician. Like, if you think that's what's best, then yeah, you decrease them.
Yeah.
And I think that was the moment where it clicked and I was like, I'm not a student anymore.
It still hasn't clicked for me.
Yeah.
We talk about changing goals.
Uh-huh.
Like, I forget that, like, if I don't like a goal or if they've surpassed it, like, I can just change it because I'm a professional and I can just change their goal and make it more appropriate. Like, that's still one thing that I'm like, I forget that, like, I'm the, like, it's
You're
crazy.
the captain of the ship.
Yeah.
Yeah.
So, the transition was interesting, but, like, I feel like we're getting a little better.
Yeah.
Like, at, like, being independent and, like, feeling more confident, I guess.
Awesome. Do you have any tips for any new grads coming out of school?
Mine would be to, like, not choose something that you're super comfortable with. Because that was the reason why I chose this, was, like, I knew I wanted to be uncomfortable because that's where you're going to learn the most. So, you know, if I would have went to a school system, like, I feel like I would have been pretty comfortable with what I was doing because I was comfortable with kids and but with feeding, when, like, you don't learn about it much in grad school, I knew that I was going to be super uncomfortable and, like, have to do stuff outside of work and, like, have to learn more because your fellowship, I mean, it's 9 months where you have all these great resources. You have supervisors, you have coworkers that, like, you need to pull and learn and absorb from so that once you are on your own, like, you feel more confident. And I would say for sure to try to pick something that you're not super comfortable with.
I would also say find a place that has that support, like, from, not just from supervisors, but from everyone else there. It really makes a difference when you have a good community around you, just in how you can learn and best support your patients.
Okay. Is there anything else that you would note that is different from, like, being a grad student to being a CFY besides getting paid?
Whoop. That's
nice.
a great one. That is one of the craziest things, I think, was, like, this is my literally first, like, real job that, like, I'm making my own money and doing all this stuff, and I was like, I feel like that was one of the times that I realized, like, oh my gosh, like, this is it.
And I think that's one of the things that I like best about our specific jobs is not only are we supported as clinicians, but we're supported as people. So, like, I can talk to my supervisor about how do I budget money and how do I mow grass and how do I buy a house. And, and I feel that support in so many areas. So we're very supported and very valued personally, but also professionally as well.
Yeah,
and it's made
definitely.
a huge difference,
Oh
I
my
think,
gosh.
for us.
That's awesome.
Yeah.
I
Trying to
think
think of anything else about our fellowship.
What's your favorite patient?
You can ask that.
You can tell, like,
Case
What
study.
type?
yeah, a case study. No specifics.
I don't know. I have too many. I literally call my mom every night and tell her about all my kids, and she's like, you said that one was so cute yesterday, but it's a different one today. I'm like, they're literally all so cute and all so great. Like, I can't do that. I'm not answering.
Is there a particular kind of group of children that you like? Like, do you prefer, like,
Yeah, because we're
dealing
kind of,
with
I feel like we're kind of
autism,
opposite
or
with that.
With what?
Like, ages that we like versus type of therapy and stuff.
Oh, yeah. Very different.
is there any particular diagnosis that you like working with more than?
So I personally, and I've always loved autism. So, like, I had a lot of it in grad school, and I love working with kids with autism. I'm also a super big, if we're not talking about feeding, more speech, I love early intervention. And Becca, that's not her favorite.
As far as not feeding, I'm doing a lot of, like, literacy with older kids, and then a lot of augmentative communication. So Carly works more, I think, with the younger kids, which I do too, but then I'm doing a lot with, like, the school age kids, which has been a lot of fun.
Yeah. I love language and literacy too. Like just
Yeah.
books.
Mm-hmm.
I always have
Yes,
books in the
we
room.
like books.
Always.
If you could only have one therapy tool, what would it be? Okay, pick two.
Can a book be one?
Yeah.
You can do so
But
much
it has to be a
with a book.
specific book.
I really like my big book of, there's two. There's a big book of ABCs, and then there's a You Choose book, and it's a huge book, and each page is like, where would you live if you could, and it has all the different houses, or like,
cool.
it's like, and you can use like that for language samples, you can use it for therapy. I really like that book for a lot of different, for all ages. I mean, I feel like bubbles are like
Classic.
great.
Yeah.
So bubbles in a book. That would be me, maybe. I think. What about you?
I'm really into squigs right now.
Pull, push, pop. That's like this. That should be the slogan. On the
Even
thing.
feeding
Pull, push,
therapy.
pop.
I use it for feeding
Oh,
therapy.
yeah.
I-
What would be your feeding tool? Like that, if you could only bring one thing into like a feeding session, what would you pick?
Pop the pig.
For an older kid,
No.
that would be. Huh?
Even younger kids. I've used it as young as 2.
Yeah. Okay.
Yeah, because then you feed the pig, and then you feed the pig the food that you're supposed to eat.
Our new spinny
Oh.
plates, if you had it.
Yeah, we have some cool spinning
We have
plates.
some cool stuff.
There's a book called Walking Through the Jungle that I really love.
Mhm.
That one's really cute.
It's got really cool pictures and a lot of good, like target words for sounds, and a lot of good verbs. So I use that a lot.
That's why I love the ABC book too. So if you're working on a specific sound, you can go to that page that has all, like it's literally a whole page of that sound. Or if you're working on labeling, it's like filled with objects that start with every sound. Like it's a really good book.
Cool.
Anything else?
I can't think of anything.
Anything interesting to talk about? We talked about a lot.
I think that's it.
Yeah?
If
Alrighty.
you have questions, let us know.
Yeah. If you have anything else, see you later.
Bye-bye.